Alright, so you're welcome to another episode of my live session. So I think this will be the third live session or fourth, maybe fourth live session I've done on this channel. So I'm going to be going straight or hit straight to this. Nobody is here yet though, but let's just go straight so that anyone who joins can just know what is going on here. So today we are going to be talking about facts and myths about Alzheimer's disease and dementia. So in my previous live session and even in my videos that I've uploaded, I talked about the difference between Alzheimer's disease and dementia. So if but I can also explain over here what Alzheimer's disease and dementia is. So Alzheimer's disease is in dementia. Let me say it like that. Dementia is a group of symptoms, and Alzheimer's disease is one of the symptoms of dementia. Please, I hope you are getting me right. Okay, so I'm going to be going straight to the point, starting from the first. But before that, this video is for educational purpose only and not to diagnose anyone of any disease. It's just for educational purpose only. Okay, so let's get into it. So the first fact I'll be talking about over here is Alzheimer's disease. So I'll be looking over here because I've written the point over there. So the first fact is Alzheimer's disease is the most common form of dementia. And this is very true. We have other forms of dementia like vascular dementia, which deals with brain, the blood not being able or reduced blood flow from the brain, reduce blood flow to the brain. That's also one form of dementia. That's the vascular dementia. But then I don't know what we often hear about is the Alzheimer's disease, and it happens to be one of the most common form of dementia that we've been hearing about, accounting for 60% to 80% of cases. That is the Alzheimer's disease. The next the next fact I have over here is dementia is not a normal part of aging. Okay, so I just saw one person join over here. Please give me a hi and let me know that you're following, and please like this video as well, and also please subscribe to this channel if you haven't for more health tips. So I'm talking about Alzheimer's disease facts and myths about Alzheimer's disease. And what I said first is that Alzheimer's disease happens to be one of the common type of dementia we most at times hear about, even though there are other types of dementia. But then Alzheimer's disease happens to be one of the most common dementia that we often hear about. An example of one of the common dementia that we hear about is vascular dementia. That is the reduced flow of blood to the brain. That's one form or example of dementia. So please like this video if you are getting value from this video, and please give me a hi and let me know that you are actually following whatever I'm saying over here. So the next fact that I have over here, hello, please, is the name Michelle, right? Michelle Kushner. If only I'm right over here, please let me know if I'm right. Michelle, if I'm right, Michelle Kashna, right? Michelle says hi. All right, Michelle. Thank you very much for joining. I'm very grateful. Please like this video, and Michelle, please also subscribe to this channel so that you can get more of my health tips. And Pickle Master says hi. Thank you very much, Pickle Master. Please like this video and Please kindly subscribe to this channel so that you can get more of my health tips. Thank you very much. I'm very grateful that you've joined. Pickle Master, thank you very much. Michelle, thank you very much for joining. I'm very, very grateful. Thank you. So the next fact that I was talking about here is that dementia is not a normal part of aging. So I'm looking here because I have written certain points down that I'm discussing with you over here. So dementia is not a normal part of aging. That's very true. The fact that someone is aging does not mean that the person must have dementia. No, no, no. It's not a fact that the person has aged to a certain level, so he or she must get dementia. No, that's not it. So this is one fact about Alzheimer's disease and dementia. Aging does not mean that you are going to get dementia. All right. So the next fact, third fact I have here is Alzheimer's disease is a progressive condition. This is very true. Alzheimer's disease is a progressive condition, and in my previous live session, I talked about the fact that Alzheimer's disease has three stages. Olivia Johnson says hello. Hi, Olivia. Thank you for joining. Hi, Olivia. Thank you very much for joining. Please give this video a like and please subscribe to this channel. Olivia says, where are you from? So I'm in Ghana. Olivia, I'm in Ghana. Kauna, please, am I right with the name? Kauna says hello. Hi, Kauna. Thank you very much for joining. I'm very grateful. Olivia Johnson, thank you for joining. Please kindly give this video a like and also don't forget to subscribe to this channel. Please don't forget to subscribe to this channel and Kauna, give this video a like so that this video can reach a lot of people who don't really know much about Alzheimer's disease and get enlightened about it. Staycation World. Staycation World. Thank you for joining. Olivia says, I already like and subscribe. I'm very grateful, Olivia. Thank you very much. Thank you. Thank you very much, Olivia, for liking. Thank you for subscribing as well. I'm very grateful. Thank you. So I was talking about the fact that Alzheimer's disease is a progressive condition. This is very true. Alzheimer's disease is a progressive condition. Michelle says she has liked the video. Thank you very much, Michelle. And I hope you've subscribed as well. Thank you very much, Michelle, for liking. I'm very grateful. Thank you, Michelle, for subscribing. Michelle says, and subscribed too. Thank you very much, Michelle. Thank you. So, Alzheimer's disease is a progressive disease. This is very true. It's not a one day disease and you just get it. It's little by little, little by little. Then, as I said in my previous live session, that was Saturday, yesterday, I talked about the fact that Alzheimer's disease is in three stages: the early stage, the moderation state, and the late state. That's what I talked about. So all these process even means that it's a progressive state. It's not just one day, then you get it's no, it's progressive. Kauna says hello. Duvo de nouvelle. Unfortunately, I don't understand this language, but I understand the hello part. That's the English part. Kauna, please, can you translate it to English so that I can read it out, please? But I understand the hello part. I understand the hello part. Okay, so as I said, it's a progressive disease. It's little by little, little by little. It's not a one day something. The next point I have over here is there is no cure for Alzheimer's disease. Okay, it's true though that we don't really have any particular cure for Alzheimer's disease, but then with treatments and manageable lifestyle moderation, you can be at a lower risk of getting Alzheimer's disease, even though we don't have a particular treatment. But then, if you are able to take care of your lifestyle, if you are able to moderate the way you eat, and take good care of yourself, being physically active, you are going to be at a lower risk of getting this Alzheimer's disease. And please note that this video is for just educational purposes and not to diagnose anyone of any disease. Okay, so next I have here is early detection and diagnosis are crucial, very important. It is very important that you diagnose it early or get to know it early, because knowing it early can help very much. Knowing that early can help and even reduce the risk. Okay, so the next point I have over here is Alzheimer's disease affects memory, thinking, and behavior. Very true. Most of the times people think that maybe Alzheimer's disease is only only affects the brain, but not. It's not it. Alzheimer's disease affects behavior as well, not only the brain. It does affect behavior as well. So it's not only the brain, and with that affecting the behavior, it turns that the person's relationship and life gets impacted because of this disease. The seventh point I have, please, I hope you can hear me very well. Please let me know if you can hear me very well. Kauna is saying something over here, but I'm not able to read the language over here. Please, if you can translate it to English for me, I would be very okay so that I can read it out here. Okay, so the next point I have here is dementia is dementia is a leading cause of disability and death. So, with research, it has shown that about 50 million of people happen to be affected with dementia, meaning that it's a very serious disease that needs to be addressed. People have to take good care of themselves and be aware of this disease, dementia, because research has shown that 50 million of people annually happen to be affected by this particular disease. My 8 points that I have here is Alzheimer's disease is a complex disease. This is very true. Alzheimer's disease is a very complex disease, and it's about multiple genetic and environmental factors. It's involving multiple genetics and environmental factors, such as being exposed to chemicals. And research has shown that people who are normally exposed to these toxins and chemicals can also be at a higher risk of getting Alzheimer's disease. The next point I have here is family history. It's very true. Family history can be a significant risk factor of having Alzheimer's disease, but it doesn't mean that so far as a family member had it, you must have it. No, taking good care of yourself, living lifestyle that is going to make you be at a lower risk of getting Alzheimer's disease does not mean that so far as you have a family member having Alzheimer, you are also going to have it. If only you take good care of yourself, you are not going to have it. The next point here is genetics plays a role in Alzheimer's disease. That's true. Genetics plays a role in Alzheimer's disease, but not always the case. Not always the case, but then genetics does play a role in Alzheimer's disease. Next is lifestyle factors can influence Alzheimer's risk. This is very true. This is very true. Having certain lifestyles can also increase your risk or lower your risk of getting Alzheimer's. So, example, living sedentary life, you are always in the house, you don't do much of walking, you don't do much of exercise, always in the house, and even being in the house, you are always either idle, you are not doing much of things. That's another lifestyle that you must detest from. You have to do much of exercise so that you don't be at a higher risk of getting Alzheimer's disease. And you have to interact socially, talk with people, also. So the next point I have over here is, please give me a high if you are following whatever I'm saying. Please give me a high if you are following whatever I'm saying, so that I'll know that you are following. Okay, so I have the next point as, Alzheimer's disease can be diagnosed certainly after death. Certainly, the word here is certainly. So when someone kicks the bucket and maybe the person died of Alzheimer's disease, but then they weren't certain about it, after the death, the person can go through autopsy and the pathologist can conduct certain tests from the brain, certain tissues, to get to know what exactly killed or made the person die, whether it's from Alzheimer's disease. So when the person died, it's certain they can get to know what exactly caused the death. Kauna says hello. Hi Kauna, hi. Please, I hope you like this video and you subscribe to this channel too for more health tips. Okay, so the next point I have here is, combination therapy may be more effective than monotherapy. Very, very, very true. Alzheimer's disease is not based on only one test. It's not based on only one test. We go they normally go through combine different kind of tests to before they can diagnose someone of that particular disease. So it's not based on only one test. Different tests to show or to know whether somebody is actually having that particular disease. And I have videos on Alzheimer's disease on my channel, so you can check those videos out to know more about Alzheimer's disease. I have made a video on foods that you can eat to take good care of yourself to reduce your risk of getting Alzheimer's disease. I've also made a video on risk on certain signs, early signs of Alzheimer's disease. Okay, so the next point here is, non-pharmacological intervention can also manage Alzheimer's disease. Very true. So non-pharmacological interventions are those activities that are done or that do not involve medication. So like exercise, those things that do not really involve medications can also help manage Alzheimer's disease. Taking good care of the person, talking with the person, they are all non pharmacological interventions. They don't need medications, right? Okay, so the next point here is that Alzheimer's disease affects not only the person with the disease. Very true. Alzheimer's disease does not affect only the person with the disease. No, it does not affect only the person with the disease. It does not affect us in they are affected with the disease, but then they are disturbed. The family members of the people get disturbed. So it's not only disturbance, the disturbance is not only on the person having the disease, but then the person's family members can also get disturbed when it happens that way. So Alzheimer's disease does not only disturb the person affected, but then the person's family members also tend to be disturbed. The next point I have here is, Alzheimer's disease affects not only the brain but also the body. This is very true. It's not only the brain that is affected by Alzheimer's disease, but the body too. In my previous videos, I talked about the fact that sometimes they lose their appetite. Losing appetite is not the brain, right? It's the body. The body's appetite, like the rate at which they want to eat, some of them is lowered. Some of them happen not to like food much, leading to malnutrition. That's one point or fact about Alzheimer's disease. they happen to lose appetite. And this is a proof to show that Alzheimer's disease is not only affected by the brain, does not only affect the brain. The next point I have over here is people with Alzheimer's disease may experience changes in appetite. As I said earlier, people with Alzheimer's disease may experience changes in appetite and eating habits. Very true. They may experience changes in appetite. They may not want to eat. They may not even have the appetite to eat, and this leads to malnutrition. This leads to malnutrition. The next point is Alzheimer's disease can impact sleep patterns. Alzheimer's disease can impact sleep pattern, and this is very true. Please give me a hi or hello and let me know that you are following what I'm saying and like this video. And please don't forget to subscribe to this channel for more health tips. So Alzheimer's disease actually impacts sleep patterns, and this is very true. And it can even lead to insomnia or daytime fatigue because you are not able to sleep. And insomnia means it becomes difficult to sleep. You are not able to sleep. That's the meaning of insomnia. The next point I have here is Alzheimer's disease happens to be the seventh leading cause of death. Seventh leading cause of death. So what does this show? It means that we have to be enlightened on this disease. We have to really take care of ourselves and take care of our loved ones, especially those who have gotten this disease. We have to take care of them as well because it happens to be the seventh leading cause of death, accounting for over 1,100 and accounting for over 120 deaths annually. So this means that we have to really take good care of our loved ones, especially those who have gotten this disease. This is the time that we have to get closer to them. We have to know more about what they are going through, how we can help them. All these happen to be very important. The next point I have here is Alzheimer's disease can increase the risk of anxiety and depression. This is very true because if we don't even, and this happens more when we don't get closer to our loved ones who are going through this kind of disease, they happen to be more depressed, they happen to be anxious. Is going to happen to them? They happen to be quite, they feel like they are unsafe. Yes, so that's why I'm saying we have to be closer to them. This is the time we have to get closer to them to know more about them. Please, I hope you are getting my point. Please, I hope you are getting my point. So this video is just for educational purpose and not to diagnose anyone. So please, as I said earlier, let me give me a hi and let me know that you are following whatever I'm saying over here. Okay, and the next point is Alzheimer's disease can impact a person's ability to communicate effectively, leading to changes in language and behavior. When someone happens to get Alzheimer's disease, sometimes they happen to be unable to communicate very well. Even they are unable to grab certain informations like people's name, even those around them, they happen to forget their names. That is one fact about Alzheimer's disease, forgetting people's names, unable to learn new information. This is one particular fact about Alzheimer's disease. And the next point here is Alzheimer's disease can increase risk of infections. This very point is very, very true. Alzheimer's disease can really increase risk of infection, example pneumonia. And how? One may ask, how does Alzheimer's disease increase risk of infection? The point is, Alzheimer's disease, when it happens that way, they are unable to, some of them use the word, some of them are unable to swallow, leading to dysphagia, if I pronounce this word, dysphagia. So they are unable to swallow. So as a result of that, the food has to be passed through their airways. That's aspiration of the food. So liquid substances and other substances are used to pass through their airways so that they can get to eat it. And this over time can cause pneumonia. Please, I hope you are getting me. This over time can cause pneumonia. So Alzheimer's disease does not come alone. They attract other infections like bacterial infections, pneumonia. They are all part of getting Alzheimer's disease. So this is also one fact about Alzheimer's disease. The next point here is people with Alzheimer's disease may experience changes in balance. Very true. Most of the time they are unable to walk very well or move very well, and sometimes they happen to be falling. Yes, for just falling like that. That's also one point over here. Most of the time they are unable to maintain their balance, leading to increased risk of falls. That's very true. The next point here is that people with Alzheimer's disease may experience changes in their sense of smell. This is very true. People with Alzheimer's disease happen to be unable to sense or smell. As a result of that, they're sometimes unable to even smell some of their favorite perfume and other stuff. And this happens to impact upon their ability to respond to certain stimulus. This is one point. So people with Alzheimer's disease may experience changes in their sense of smell. The next point I have here is people with Alzheimer's disease may experience changes in their ability to drive. This is very true because of cognitive decline. Sometimes too, some of them have problems with their visualization, especially at night. They are unable to really concentrate well too sometimes, so they it is not advisable for them to drive, or they are unable to drive sometimes. So these are the facts about Alzheimer's disease, and I'll be talking about the myth very soon. So reach out let me talk about each point, or in summary. So the first point I talked about is Alzheimer's disease is the most common form of dementia. What I said next is dementia is not a normal part of aging. 3. Alzheimer's disease is a progressive condition. 4. There is no cure for Alzheimer's disease, but with manageable treatment, you can be at a reduced risk. 5. Early detection and diagnosis are very crucial. So I'm talking about some of the facts, the points I talked about. So 6, I said Alzheimer's disease affects memory, thinking, and behavior. 7, dementia is a leading cause of disability and death. 8, I said Alzheimer's disease is a complex condition, hence it involves multiple genetic and environmental factors. Next, I said age is the greatest factor, risk factor of Alzheimer's disease, but it doesn't mean that so far as you've aged or you've reached a certain age, you have to know. With taking good care of yourself, lifestyle moderation, you are not going to be at a higher risk. Next, I said family history is a significant risk factor. Family history is a significant risk factor. 11. Genetics play a role in Alzheimer's disease. Genetics does play a role in Alzheimer's disease. Next, lifestyle factors can influence Alzheimer's disease. Very true. As I talked about the sedentary lifestyle, lifestyle factors can also influence Alzheimer's risk. The next point I have here is Alzheimer's disease certainly can be diagnosed certainly after death, certainly certain after death through autopsy. Through autopsy. The next point here is combination therapy may be more effective than monotherapy. Combination therapy may be more effective than monotherapy. So I'm just talking about the points that I explained. I'm just giving out the points so that anyone who came in just now will know what I'm talking about. So the next here is non-pharmacological intervention can also help manage Alzheimer's disease. Non-pharmacological interventions can also help manage Alzheimer's disease. The next point here is Alzheimer's disease affects not only the person with the disease, but also their caregivers and loved ones. Very true. It's not only the people affected with Alzheimer's disease who happen to be disturbed, their caregivers also happen to be disturbed in the long run. Next is Alzheimer's disease affects not only the brain but also the body. This is very true, especially with the losing of appetite resulting in malnutrition. Alzheimer's disease does not only affect the brain but also the body. My next point here is that people with Alzheimer's disease may experience changes in appetite. People with Alzheimer's disease may experience changes in appetite. So I've talked about this point already. I've talked about this point already. The next point is that Alzheimer's disease can impact sleep patterns. Very true. Alzheimer's disease can impact sleep patterns. The next point is Alzheimer's disease happens to be the seventh leading cause of death, accounting for over 120,000 deaths annually. This means that we have to really be enlightened on this particular disease. Next here is Alzheimer's disease. So I'm just giving out the points that I talked about. Next year is Alzheimer's disease can increase risk of depression and anxiety. Alzheimer's disease can increase risk of depression and anxiety. And next point here is that Alzheimer's disease can impact a person's ability to communicate effectively. Alzheimer's disease can impact on one's ability to communicate effectively, leading to changes in language and behavior. As I said when I was explaining that most of the times happen to forget the people around them, their names. This is one point over here. And the next point here is Alzheimer's disease can increase the risk of infection. So I explained how how Alzheimer's disease can actually increase risk of getting infections. Example, pneumonia. As I said, that some of them are unable to swallow. As a result of that, aspiration of food has to come in, and aspiration means that the food is passed through their airways, and this as a result of dysphagia, and this can go a long way to cause pneumonia over time. The next point I have here is people with Alzheimer's disease may experience changes in balance. Very true. Sometimes people with Alzheimer's disease may experience changes in balance. Sometimes they are unable to stand well, they are unable to move, and this may result in frequent falling. The next point here is people with Alzheimer's disease may experience changes in their sense of smell. Changes in their sense of smell. So it happens this way that even with their favorite perfume, they are unable to sense it, and this happens to impact on their ability to respond to certain stimulus. Next point here I talked about is people with Alzheimer's disease may experience changes in ability to drive. Very true. They are sometimes unable to drive very well because of one way or the other cognitive decline or even visualization problems. So now let's talk about some myth of Alzheimer's disease. What causes some myth or what people think about Alzheimer's disease that may not be it actually. So the first thing I have here is Alzheimer's disease is caused by hardening of the arteries. Hardening of the arteries. This is not right. It's not caused by hardening of the arteries. The reality is Alzheimer's disease is a complex disease involving multiple genetic and environmental factors. So it's not about hardening of the arteries. It's complex. It involves different things, and it can be from environmental factors and multiple genetics. So when I talk about environmental factors, I'm trying to say being exposed to certain chemicals and toxins. That's one point over here. That's one environmental factors. And research has shown that being exposed to certain toxins, certain chemicals can increase one's risk of getting Alzheimer's disease. Okay, so the next point here is people with Alzheimer's disease are always forgetful. Very true. People with Alzheimer's disease, no, not always true. This is not always true. People with Alzheimer's disease happen to be forgetful. It's true that they happen to be forgetful, but it does not happen to everyone. This is the fact here. The myth is they are always forgetful. The word is always, and the fact is it's not always. It's not that they are all always forgetting things. Some of them are able to remember certain crucial, certain one things, especially at the early stages of Alzheimer's disease. Certain people are able to remember certain one, two things in their life. So it's not that they are always forgetting about things. The next point myth I have here is Alzheimer's disease only affects older people. Alzheimer's disease only affects older people. And this happened to be a myth that is really going around, that most people think only older people can get Alzheimer's disease. It happens to be rare in younger people though, but it's not written down that only older people get Alzheimer's disease. No, even though older people do get them often, but it's not written down that only older people get Alzheimer's disease. No, no, no. Okay, so the next myth I have here is people with Alzheimer's disease are always aggressive and violent. This is a myth too. It's not always that they happen to be aggressive. It's not all of them. Even though they might be having certain behavioral changes, it's not a universal symptom that they all happen to be aggressive. No, it's not a universal symptom. The next point I have here is Alzheimer's disease is contagious. This is also one myth over here. Alzheimer's disease is contagious. No, 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 no. Alzheimer's disease isn't contagious. Alzheimer's disease isn't contagious. The fact that you are closer to someone having Alzheimer's disease does not mean that you are also going to get it. It has not spread from person to person. That is one myth and its reality. Next point is there is nothing that can be done to prevent Alzheimer's disease. This is also one myth. Something can be done, even though we don't really have a particular thing that we can do to prevent Alzheimer's disease, but with checking your lifestyle moderation, being physically active, checking your diet. There are all ways that you can engage yourself in to reduce your risk of getting Alzheimer's disease. So even though it is true that we don't really have a specific way to prevent it, we have combination of certain things you can do to reduce your risk of getting Alzheimer's disease. The next point here is Alzheimer's disease only affects the brain. No, Alzheimer's disease does not affect only the brain. It also affects the body, like the systems, respiratory system, cardiovascular system, gastrointestinal systems. And one example of the respiratory system I talked about was the fact that pneumonia can be one, because most sometimes people are affected with dementia are unable to swallow. As a result of that, aspiration of food has to come in. Food has to be passed through their airways, and as a result of dysphagia, and this can cause pneumonia. The next point I have here is people with Alzheimer's disease. This is one myth. People with Alzheimer's disease are always bedridden. This is not very true. Even though some of them happen to be laying in bed most of the times, but it does not happen to everyone. Some of them are able to walk, some of them are able to go about with certain activities. They are not bedridden. It's not all of them who are bedridden. So this is also one myth that we are trying to clarify over here, that it's not everyone who happens to be getting Alzheimer's disease is bedridden. Some of them are able to go about with certain physical activities. The next point here is Alzheimer's disease is a normal part of aging. This is another myth. Alzheimer's disease is not part, it's not like it's fixed. If you are age you have to get, no, it's not fixed that so far as somebody is age the person has to get Alzheimer's disease. No, it isn't fixed at all. It isn't fixed at all. Next point here is there is no hope for people with Alzheimer's disease. This is a myth. There is no hope for people with Alzheimer's disease. There is hope, even though we don't have a specific cure for Alzheimer's disease. With manageable medications, manageable lifestyle moderations, people are able to live longer. So, what shows there is no hope here? There is hope over here if only you are able to follow what your doctor tells you to do. So, let's go over the points that I've talked about. So, what I just said, Alzheimer's disease, one myth is there is no hope for people with Alzheimer's disease, which is a myth. Next one is Alzheimer's disease is a normal part of aging. This is also one myth. Next one here is people with Alzheimer's disease are always bedridden. This is also one myth. Alzheimer's disease only affects the brain. This is also one myth. There is nothing that can be done with to prevent Alzheimer's disease. This is also another myth. Alzheimer's disease is contagious. No, this is also one myth. Alzheimer's disease happens to be, it's not contagious. Next, people with Alzheimer's disease are always aggressive and violent. This is also one myth. People with Alzheimer's disease happen to always, the word always, they makes it a myth. It's not everyone, it's not a universal symptom. The next point I have here is Alzheimer's disease only affects older people. No, it's not only older people who happen to get Alzheimer's disease. It's not only older people. The next point here is people with Alzheimer's disease are always forgetful. Over here again, the word always makes it a myth. It's not always the fact that so far as somebody has Alzheimer's disease, they are old. No, being old does not mean that you are going to get Alzheimer's, even though it happens to most people who are older. It's not a factor, a very big factor. It's not very, very big, even though it happens to be that most people who are old normally get it. Next myth here is people with Alzheimer's disease are always forgetful. Are always forgetful. The word always makes it a myth. It's not always that they happen to be, especially during the early stages. Especially during the early stages, it's not always the fact that they are always forgetful. And the first point I made here is Alzheimer's disease is caused by hardening of the arteries. No, this is also one point here. Alzheimer's disease is not caused by hardening of the arteries. So this is about myth. So let me wrap up with the fact. So the facts I talked about is people with Alzheimer's disease may experience changes in their ability to drive. That's also one fact because of certain cognitive decline, and also because of certain cognitive decline, people with Alzheimer's disease are normally unable to drive. That's very true. And next point I made is that people with Alzheimer's disease may experience changes in sense of smell. This is very true. People with Alzheimer's disease may experience changes in sense of smell. Next, people with Alzheimer's disease may experience changes in their balance. Sometimes they are unable to stand very well. This happens to be one point or one fact about Alzheimer's disease. Next point I have here is Alzheimer's disease can increase risk of infections such as pneumonia and urinary tract infections. Very true. Because sometimes they are unable to swallow, as I said earlier, due to this phalangia, aspiration of food has to come in. So instead of the food passing through their mouth, the food is passed through their airways, and this over time can lead to pneumonia. Next point here is Alzheimer's disease can impact a person's ability to communicate. That's also one factor about Alzheimer's disease. And the next point I have here is that Alzheimer's disease can increase risk of depression and anxiety. This is very true. Alzheimer's disease can increase risk of depression and anxiety because they happen to be anxious about what is happening to them and all stuffs. They increase risk of anxiety, which impacts the person's quality of life and relationship. The next point I talked about is Alzheimer's disease is the seventh leading disease that can cause death. This is also one fact, and as a result of that, is accounting for over 120,000 deaths annually. This means that we have to really be enlightened on this particular disease. We have to really get to know more about Alzheimer's disease because it happens to rank seventh among the leading cause of death, accounting for over 120,000 deaths annually. So Alzheimer's disease happens to really cause death, and we have to really be enlightened on the risk factors of this particular disease. The next point here is Alzheimer's disease can impact sleep patterns. That's one fact about Alzheimer's disease. Alzheimer's disease can actually impact sleep patterns and leading to insomnia, daytime fatigue, and other sleep related problems. The next point here is Alzheimer's disease may experience people with Alzheimer's disease may experience changes in appetite and eating habits. This is very true. They happen to lose their appetite. People with Alzheimer's disease happen to lose their appetite. So this is one fact leading to malnutrition and weight loss. This is also one fact. The next point I talked about is Alzheimer's disease affects not only the brain. It's not only the brain that happens to be affected with Alzheimer's disease. The body also gets affected with Alzheimer's disease. So this is one point. And this happens to increase the risk of malnutrition, falls and other health complications. So Alzheimer's disease does not affect only the brain, it also affects the body. And I said in one of my points that it affects the body and also the respiratory systems, causing pneumonia, urinary tract infections, and other stuffs. The next point I talked about is Alzheimer's disease affects not only the person with the disease, and this is very true. It's not only the person who is affected by the disease happens to be disturbed, their loved ones happen to be disturbed because of certain problems. Example, financial issues can also be one reason. And also it's so sad. Just imagine knowing someone for years or having a very close family member and all of a sudden the person happens to act differently, happen to get certain behavioral changes, happen to forget your name. It's very sad. So it happens that I said in my previous live session that people taking care of others having Alzheimer's disease have to seek for help because taking care of people with Alzheimer's disease can be very challenging over here. It can be very, very challenging. So this is also one point. Next point is non-pharmacological interventions can also help manage Alzheimer's disease. And this is very true. Non-pharmacological interventions can help manage Alzheimer's disease, including behavioral therapy, caregiving, and environmental modification. So, if you happen to be more exposed to an environment that has, if you happen to be more exposed to an environment that contains more, they do more of toxins, chemicals, you have to be very careful because being exposed to toxins, chemical pesticides can increase your risk of getting Alzheimer's disease. So you have to be very careful about that. The next point I made with the fact is that combination of therapy may be more effective than monotherapy. This is very true. Combining different kinds of therapy can help reduce one's risk or manage one's Alzheimer's disease instead of using only one particular therapy, monotherapy. So it is important that we adapt using different kinds of therapy to help prevent this Alzheimer's disease from managing Alzheimer's disease symptoms and slow down the progression. Okay, so the next point I made here is Alzheimer's disease can be diagnosed with Alzheimer's disease can be diagnosed certainly after death. The word here is certainly, certainly after death. So after death of one, maybe they were unable to diagnose the person of having Alzheimer's disease initially, but after the death of the person, the through autopsy, they can diagnose the person of Alzheimer's disease. That's after the person's death. So one fact about Alzheimer's disease is after the death of the person, one the pathologist can diagnose the person of maybe having Alzheimer's disease through autopsy. So looking at the brain and certain tissues, they can diagnose the person of having Alzheimer's disease. Okay, so please, I hope you are finding information, you are finding value in this video. So please kindly give this video a like so that other people can see this video and get enlightened on this Alzheimer's disease. And also you can subscribe to this channel so that you don't miss out on any health tip that I bring on board over here. The next point I made is Alzheimer's disease. The next point I made here is lifestyle factors can also influence risk of getting Alzheimer's disease, and this is very true. This is very true, especially living sedentary lifestyle can be one point or can be one big risk factor of getting Alzheimer's disease, because you happen to be immobile, you happen to be living sedentary lifestyle, meaning you are always either lying down, sleeping, always sleeping. You have to be immobile, you are not doing much of physical activity. This can increase your risk of getting Alzheimer's disease. The next point I talked about here is that genetics can also play a role in Alzheimer's disease, but it's not solely the cause of Alzheimer's disease. It's not solely the cause of Alzheimer's disease. It's just like family history. Genetics is not solely the cause of Alzheimer's disease, but then it happens to be one reason or one fact that it can play a role in Alzheimer's disease. The next point here is that family history is a significant risk factor. So having traces of Alzheimer's disease in family can also be a risk factor. So you have to be very careful about your lifestyle, how you take, how you do your things, your lifestyle moderation. You have to take good care of them, because if you have traces of family history of having Alzheimer, you have to be very careful because you might be at a risk of getting this disease. So please give this video a like. Don't forget to subscribe to this channel, and also let me know in the comment section what you know about Alzheimer's disease, what you've heard about Alzheimer's disease, certain myths you've heard about Alzheimer's disease, certain facts you know about this disease. And this video is for educational purpose only, and not to diagnose anybody of any disease. It's just to educate people on this particular disease. The next point here is that age is the greatest risk factor for Alzheimer's disease. So age happens to be one risk factor, but I said in the myth section that having old age does not mean that you are going to get Alzheimer's disease, but it happens that most of the times old people happen to get this disease. That is the fact we are bringing out over here. The next point is Alzheimer's disease is a complex condition, and this is very true. Alzheimer's disease is a complex condition. It's not simple, it's complicated. It involves multiple and environmental factors, and I talked about the fact that environmental factors is example being exposed to toxins, chemicals, pesticides, and research has shown that being exposed to these toxins, chemicals, and pesticides can also increase one's risk of getting Alzheimer's disease. So this means that having Alzheimer's disease does not mean that it's only the memory that is affected. No, the mind happens, the thinking happens to be affected, the behavior of the person happens to be affected. So this is this is also one point over here. It's not only the mind, not the only the memory that happens to be affected. The life, the person's thinking, the person's behavior happens to also be affected. The next point I have, I'm very sorry if you didn't hear my voice. My microphone actually went off without me noticing over here. So the next point here is that early detection of diagnosis are crucial. So it's very important to detect early that maybe it's very important to detect. The next point here is that Alzheimer's disease is the most common form of dementia. This is very true. As I said earlier, we have different forms of. The next point is people with Alzheimer's disease happen to be the next point is Alzheimer's disease is a progressive stage. It's a progressive disease. It's not like one time thing. It has stages: early stage, moderation stage, and then the late stage. So this means that Alzheimer's disease is not just a one time thing. It's progressive. It's not a one time thing. Please, I don't know if you can hear me very well. My microphones are off, so please let me know in the comment section if you can't hear me well. The next point here is there is no cure for Alzheimer's disease. That's true. Even though there is no very cure for Alzheimer's disease, upon running certain tests, certain combination of tests, we can manage this particular disease. And going by your doctor's prescriptions, you can manage and live longer. So please, I hope you found this video very helpful. Thank you all for joining. I'm very grateful for having your time on this live session. I'm very grateful. Please don't forget to like this video and also subscribe to this channel for more health tips. Have a nice day. Bye.